I think one of the reasons why minimum wage, the reason we're kind of looking at it in a new way in this particular hearing is it's not so much about policy or what we might think of it, but there are some serious budget implications and assumptions that are being made. And of course, human services is one of the largest portions of our budget. So I just want to make sure that we have the numbers right, and especially a guy like me that needs some help with that. It's my understanding that you're using Labor and Industries average wage data, correct?
Yes.
Okay. Does that data include both? I think when you were talking to Representative Culver, it includes both private and government-funded personal assistance?
Yeah, it's my understanding that it's a mix of all payer. It's not separated by payer for the service.
Okay, so it's an average. We're trying to come up with an average?
Yes.
Because I think, correct me if I'm wrong, doesn't DHS typically pay less than the private market rates for personal assistance and child care services?
Generally, I think that's what people would say.
Okay. So these, how will these employers be able to pay their employees, $12 or ultimately, if we go to $15 an hour, if we're underestimating the impact for them if they're the folks that we're reimbursing?
Yeah, so I guess I would remind you that the survey is nearly 2 years old, and we have seen, specifically in the Medicaid-covered population for the direct care workers for LTSS services, that rates have actually increased. Wages paid to employees have increased between the survey time and today.
What is the difference, you think, between what those providers get versus the private providers? In other words, the ones that we pay out. Is there, if that survey's old, are there new numbers that we should look at?
I don't have access to those numbers, no. But as I mentioned, we are meeting with the Independent Fiscal Office, and they may know of other resources that aren't available to us.
Okay. And again, Representative, to kind of go along with what Representative Culver was asking, the $74 million in federal funds, that is a block grant. And that's something that then we will pick up with the state. You had mentioned that the savings that we generate through the minimum wage increase could be used to kind of fill that gap. But $74 million is, significant money. Are there any other options if some of these projections, because they are just projections and assumptions, I assume that $74 million would have to be made up in other areas?
Yeah, I can't really speak to that. What I can say is that we came up with an estimate that we used the best available information. And so, again, I think the Independent Fiscal Office reviewed our methodology the last time this proposal was put forward and didn't find any issues with the methodology used. So I'll be interested in their input this time around as well.
I was going to start my line of questioning with referencing $87 million in fraud from Western Pennsylvania, but that seemed to be the runway for a plane that just didn't want to land a little while ago. So there was though, the reason I wanted to bring that up was I think there's a partial answer out there, and that deals with the electronic visit verification, the EVV system. I think on the website it says that EVV will be implemented for personal care services this summer. Is that still accurate?
Yes.
Okay. Do you intend to? I think the federal mandate for EVV for the home health care services is now bumped back to 2023. But we could still do it sooner, is my understanding. What is our intention in terms of the electronic visitation verification system?
So we are in the process of also reprocuring our Medicaid Management Information System, which is our claims processing system for Medicaid. And as part of that, we're rolling out various modules through different RFPs. We will include the eligibility verification system as part of one of those modules, and that's our intent, is that it would roll out with one of those modules. However, in the meantime, we are using our existing Medicaid claims payment vendor to actually implement early on EVV. We're using one of their particular modules to do what we're doing this in the summer months. So when we talk about rolling it out for personal care in the summer months, we'll be using our existing vendor, but we intend to move forward with a complete redesign.
So with hesitance, going back to that particular story from Western Pennsylvania, that took, I mean, that was over the course of 6 years, 87 million. So that's a long time to be able to engage in that kind of behavior. Do you see, as I think I do, but I'm not an expert in the field, these EVVs as possibly being a tool to protect against that kind of abuse and maybe catch it sooner? What are your feelings on the program overall?
Well, it's hard to tell because we haven't actually rolled it out and we haven't seen a lot of states with experience with it. But I think that is the intent behind the requirement, which it is a federal requirement that we implement these programs, and it was geared towards a more program integrity related activity. So we do think that there will be some opportunity to use that and look at whether or not dollars are being used and services are being provided in accordance with what our expectations
Will
are.
the system track claims by each individual worker, like through a unique ID number, or by each agency, regardless of whether, is that the intent?
Yes.
Okay. Just, I like to look for solutions. I know we've got problems, but I see this as a possible solution to some of our areas that we've been battling, and I wanted to see if you felt the same way.
Yes.
All right. Thank you, Mr. Chairman.